crushing fatigue, dry eyes, joint pain. We might just think it's menopause, or maybe that's what you've been told. And you might be right. But these also are often signs and symptoms of an autoimmune disease that's often completely overlooked. Hi, my name is Dr. Kara Wada. I'm a quadruple board certified allergy, immunology, lifestyle medicine physician. I also live with autoimmune disease, something called Sjögren's disease. And today I'm going to show you exactly how to tell the difference between menopause and autoimmune disease, because getting this wrong can cost you years of your life and suffering. Let me tell you why this topic is so personal to me. I have dedicated my career to helping people with complex immune conditions, but I've also lived it. As someone who lives with Sjögren's disease, I know what it's like to have symptoms dismissed, even by myself. I know what it feels like to be told it's all in your head, or it's just part of getting older, or just being a hardworking mom. And here's what makes me so passionate about this. The average time from diagnosis for Sjögren's is 7 years. That's 7 years of suffering, 7 years of being dismissed or gaslit, and 7 years of preventable damage to your body. And you know what time of life majority of women will get diagnosed? Right around age 50. Now, I want to make something very clear. Sjögren's disease can affect folks across the age span. And as I look back, knowing what I know now, I see that I had some breadcrumbs or some things that would make me think some things were going on even back in my early 20s. But those times of hormonal transition, around the time of puberty, around the time of pregnancy and our postpartum journey, and around the time of perimenopause, are all critical times when our body is at a higher risk of things turning over and clicking the boxes to become a diagnosable autoimmune disease. Now, if you're new here, I'd hit that subscribe button. I post evidence-based content on the overlap of allergies and autoimmune disease every single week. I don't want you to miss any of our upcoming episodes. All right, let's talk about why menopause and perimenopausal transition and Sjögren's are so deeply intertwined. I like to describe this as a perfect storm because although, TikTok is going to try to tell you there's one root cause, this is really complex physiology and there is always more than one thing going on. Now, during menopause, part of that transition is a drop in estrogen. Estrogen is not just about reproduction, it's actually protective for your immune system. It's also protective for your heart and other aspects of your body too. It's protective for some of the glands that produce moisture in your body. These are some of the parts of your body that are affected by Sjögren's. Now, Sjögren's is often talked about as a disease of dryness, but what we really know is that it is a systemic inflammatory autoimmune condition. We're going to focus a bit in on dryness here because it provides a good example of what we know is going on with some of this physiology. So first, estrogen has a protective effect on our moisture producing glands. The salivary glands, the tear glands, they depend on estrogen to help stay healthy. And when estrogen drops during perimenopause, something called apoptosis increases. That's a fancy word for saying that the cells are self-destructing. Now, here's where it gets interesting. When these cells die, they release proteins from inside the cell. These proteins are things that your immune system should, occasionally encounter, but they should recognize as part of ourself. Now, something goes wrong here. And instead of recognizing these cells as ourself, we've lost that tolerance. And so the immune system then is creating a response, an inappropriate response, saying, oh, this is a danger signal. We need to attack. And that attack and that autoimmune or self-attacking process is in part what we know about Sjögren's disease. Now, the second mechanism I think is even more fascinating. Your salivary glands aren't just passive victims. They actually have an ability to create hormones inside of them. And in men, these glands can pretty easily produce protective hormones called androgens. In postmenopausal women, our glands have to work much harder. They have to convert adrenal hormones into protective androgens through a more complex process. When you don't have enough estrogen, this process breaks down and your glands have more difficulty repairing themselves. This leaves them in a place that's more vulnerable. They're sitting ducks for an autoimmune attack, especially if other aspects of that perfect storm are taking place. If you want to learn more about the perfect storm, we did a whole series on that a couple months ago, so we'll make sure those are linked in the comments below or in the show notes below. Here's what I want you to understand though. Menopause isn't just coincidentally happening at the same time as Sjögren's. Menopause can actually play a role in this perfect storm of triggering Sjögren's in women who are genetically predisposed and who have other aspects of this perfect storm going on. I want you to drop a comment below if this is making sense so far. And I want to know if you've noticed your symptoms getting worse, for those of you who have known Sjögren's disease around that perimenopausal transition. Now, let's talk about why this gets so confusing for women and for their doctors. I call Sjögren's the menopause mimic. Check out this overlap. Dry eyes, dry mouth, vaginal dryness, skin dryness, crushing fatigue. All of these things are listed as symptoms of both perimenopause and Sjögren's. In fact, up to 30% of women over age 65 report dryness symptoms. So when you go to your doctor and say, I'm exhausted, my eyes are dry, my mouth is dry, and frankly, we're all talking a whole lot more about perimenopause. Hallelujah. We've needed that for a long time, right? But when they say, oh, honey, you're just going through menopause, this is normal. Here, have some eye drops, come back if it gets worse. Here's the thing. They're not necessarily wrong to think about menopause first, right? As women, we're all going to go through this transition if we're lucky enough to live that long, right? But it's wrong to stop there. And I want to tell you about a patient of mine. We're going to call her Jessica. Jessica spent 5 years being told her symptoms were just menopause. She had 5 years of debilitating fatigue to the point where she had to pull out of some of the things she was doing at work. She wasn't feeling like she was showing up as the mom she wanted to be. She had 5 years of not being able to wear her contact lenses because her eyes were so dry. 5 years of waking up at night with her mouth so dry she couldn't swallow. And when she finally got to me, after she had tried hormone replacement and all these things, her blood work was overwhelmingly positive and, made the diagnosis of Sjögren's, frankly, very easy for me. She had Schirmer's test, the test that measures tear production that showed almost no tears. And really, it was very clear that she had Sjögren's disease, very likely this whole time. How many Jessicas are out there right now being told to wait it out? That's what I worry about as we are advancing this conversation around menopause. I think it is so needed. I also don't want that conversation to stop right there. Now, if you're watching this and thinking, I need personalized help with this, I offer telehealth appointments in 16 states. I'll put the list in the description. But even if you're not in one of those states, make sure you're following along. We have so much incredible free educational content here. We also sometimes do have folks travel to come see me in Central Ohio. All right, let's get back to the red flags and let's get practical. What are those things that should be warning signs to make you and your healthcare team think, wait, is this something more? Is this more than perimenopause? I'm going to give you 5 key differentiators. And if you have several of these, please screenshot this list and bring it to your doctor. Red flag number 1, significant joint pain or inflammatory arthritis. Now, joint pain can increase through perimenopause, but if you are having morning stiffness that lasts for more than 30 to 60 minutes, if you are having stiffness and swelling in your hands, pain that you're noticing specifically in the joints. Over 80% of Sjögren's patients have this type of joint involvement. Red flag number 2, parotid gland swelling. This is when your salivary glands right up here on your cheeks swell up, giving you an appearance of chipmunk cheeks. Or if you have seen pictures, similar to when people would get mumps before we had widespread vaccinations. This does not happen with regular menopause. If you are getting clogged salivary glands, you're getting stones, those are also red flags to say, ooh, do we need to see, is there inflammation going on in those glands? Number 3, positive autoantibodies. In Sjögren's, we specifically will focus in on something called the anti-SSA or anti-Rho antibody, and to some degree anti-SSB called anti-La. These are blood tests. They're positive in about 60 to 70% of people with Sjögren's. Now, these are typically not positive in the context of just menopause. We also may think about checking in the context of Sjögren's, other things that may be awry. You may have a positive ANA, anti-nuclear antibody test. You may have a positive rheumatoid factor. You may have an elevated protein level or total protein level, which can signal increase in antibodies or immunoglobulins. These are things that I look for on both standard tests and also a bit more specialty tests that sometimes we'll check in patients that I'm seeing in consultation. Red flag number 4 is objective evidence of dryness. This is crucial. I'm not just talking about feeling dry, maybe needing to use, your little eye drops occasionally. But if you are going to the eye doctor and your Schirmer's test, that little strip of paper they put in to measure the amount of tears you're producing, if that's really low, that's an important key fact. If your salivary flow, the amount of spit you're producing, is measured, if that is low. If your eye staining, sometimes they'll put this fluorescein, it's like the bright yellow dye in your eyes, and look with the special tool at the optometrist, the ophthalmologist, if they see damage to the surface of your eye. Again, this is really important. And they may recommend some treatment, some intervention, because again, dry eye can go along with perimenopause. But if you are not responding as it would be expected to that treatment, again, this is a red flag that needs to be thought of. And it's not uncommon for ophthalmologists or even optometrists to sometimes really push patients to say, hey, you need to get this checked out. I'm worried about something called Sjögren's disease. In my own diagnostic journey, it was the dental hygienist who said, hey, Kara, your mouth looks really dry. What's going on? Are you on any meds that are causing this? And I wasn't. And for me, knowing what I know, that was a red flag to say, oh gosh, something's really wrong. Red flag number 5 is the symptom triad. One study found that a combination of dry mouth, a sore or burning mouth, and dry eyes correctly identified 93% of Sjögren's patients. If you have all 3 of these, this needs investigation. And again, I think it's really important, although we often will focus our medical education on the dryness that is kind of what makes Sjögren's well known and is what's testable. This is a systemic disease that very often has profound fatigue, body pain, other neurologic symptoms, chronic headaches, migraine, small fiber neuropathy, which is burning or tingling, a whole host of other symptoms along with it. And frankly, often, if you're going to see your healthcare professional for a checkup or for a problem, it's not necessarily the dryness that's bringing you in, right? More often than not, it's the fatigue, the body pain, those sorts of things, the arthritis symptoms that are really what are going to prompt you to push you to make that visit. Here's what I want you to hear. You know your body. If something feels wrong, if your symptoms are severe, they're not improving with some common interventions that we would typically use, if they're impacting your quality of life. For me, they're impacting my ability to be an effective physician. At moments, I was tired. I had to cut back on my hours for a period of time. It was interfering with my ability to show up how I wanted as a mom with, at the time, my 2 young kids. You deserve your symptoms to be taken seriously. Don't let anyone, including your doctor, dismiss you with it's just menopause without doing an appropriate workup, especially in the setting of these red flags. If you found this helpful, please hit that like button. It helps more women find this information. So does sharing it. Share it with your girlfriends. Now, there's another piece to this puzzle. What if you already know you have Sjögren's, but perimenopause is making everything worse? This is my lived experience right now as a 41-year-old going through this hormonal roller coaster. This is real. It is backed by research. One study looked specifically at postmenopausal women with Sjögren's and found something really important. Lower androgen levels were directly linked to worse dry mouth. Lower estrogen levels, worse dry eyes. So if you have Sjögren's, you're going through perimenopause and you feel like you're falling apart, you're not crazy. There's a direct, measurable hormonal component to what you're experiencing. And this is where hormone replacement therapy becomes a really interesting conversation. Now, I am not going to tell you whether or not you should or shouldn't use HRT. That is a decision between you and your doctor based on your individual risk factors. But what I will say is for some of my Sjögren's patients, appropriate hormone replacement therapy, I'm going to count myself in this conversation, has been life-changing for symptoms. And it's worth having an informed conversation about it. I also want to acknowledge that this time of life is hard enough without adding an autoimmune disease on top of it. If you're struggling, you're not alone. We have free Facebook communities, the Becoming Immune Confident community, and the Success with Sjögren's group, which are full of folks who really get it The links to those are in the descriptions. As a physician and a patient, this intersection of perimenopause and autoimmunity, it's really close to home. I think about the version of myself before my diagnosis. I think about all the times I pushed through or tried to push through that crushing fatigue, just telling myself I needed to try harder, to just get more sleep, to drink more water, to eat healthier, to work out more. I think about how I normalized my symptoms because I thought, well, I'm just getting older. I'm a busy working mom. This is just what happens. And then I think about the relief. And it actually was more grief mixed with relief when I finally figured out why I felt so terrible. And that relief wasn't crazy. Relief meant that there was a name and there was a lot of grief, both for thinking and losing kind of that identity of a healthy person, but also for that lost time. And that's why I created Stronger with Sjögren's. It's a 12-month membership program that combines physician-led education with a gentle app-based strength and mindset program designed specifically for bodies that are navigating, complex health needs, including autoimmunity. Because here's what I've learned. You can't control whether or not you have Sjögren's. You can't control perimenopause. But you can control how you support your body through these transitions. You can build resilience. You can get stronger, not despite your diagnosis, but within it. If you're in any of the states I'm licensed in, I'd love to see you for a telehealth appointment through my practice, the Immune Confident Institute. And if you're not in those states and you want me licensed in your state, join the wait list so I know where to expand next. All the links are in the description below. All right, I want to hear from you. Have you been told that your symptoms are just perimenopause? Have you struggled to get a Sjögren's diagnosis? Or if you already have Sjögren's, did perimenopause make your symptoms all that much worse? Drop your story in the comments. Your experience matters, and it might be exactly what another woman needs to hear to advocate for herself. Please don't forget to subscribe, hit that notification bell. I'm putting out new content every week to help you become immune confident. One last thing before you go. If you've watched this video and felt a little tightness in your chest because you've realized I've been bouncing between my gynecologist, my rheumatologist, and no one is connecting these dots, I want you to know we are working to solve that. The biggest frustration I hear is that women have to be the project manager of their own complex illness. You have to figure out if it's hormones, if it's inflammation, if it's metabolic stress. My team and I are building a new pathway to take that burden off your shoulders. We're launching the Autoimmune Heart and Metabolic Health Checkup. It's a comprehensive, asynchronous diagnostic process where we look at your inflammation, your metabolic health, and your long-term risks together and give you a written 12-month plan to address them. We're opening early access very soon for a founding group of clients. And if you want to be the first in the know, when those doors open, you want to stop guessing about what's happening in your body, click the link in the description to join the early access waitlist. We've built this so you don't have to spend another 7 years asking to be heard.